All right. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. Today, we're talking about vestibular migraines versus Menieres disease, or Menieres disease versus vestibular migraines, whichever one you want to put first. We're going to kind of go into both conditions and talk about what differentiates the two and how they're so overlapping by the same token. And we're joined by Kathy. Good morning, Kathy.
Morning, everyone.
And we hope everyone is having a nice weekend, holiday weekend. And Kathy, do we have any questions we want to open up with?
Yes, I think the best place to start would be how Menieres disease is diagnosed versus how vestibular migraines are diagnosed.
So Menieres disease is classically diagnosed with the clinical quote-unquote triad, or symptoms of someone presenting with episodic vertigo. And when they have vertigo attacks, lots of times they'll have severe ringing in one ear. They'll have a sense of fullness in the ear. And the vertigo is different from other types of vertigo in that it typically lasts for quite some time. So there's something called benign paroxysmal positional vertigo, where somebody lays back into their bed and all of a sudden the room starts spinning around them. But usually that vertigo lasts for 30 seconds to a minute. They may feel like off and dizzy for quite some time thereafter, even up to a week. But the actual spinning typically does not last that long. And that's why, for those of you who have dizziness, when you go to the doctor lots of times will seem impatient, and you'll say, well, I'm having vertigo. And they'll say, for how long? And people are like, I don't know, a week. But they say, no, truly, how long was the room spinning around you? Because that's really diagnostic. Now, for Menieres disease, frequently the room will spin around that person for hours, like 30 minutes to 4 hours. And if you can imagine like being on a merry-go-round for hours, you can realize how not fun that is. So that's one key feature of Menieres disease, associated then again with the pressure in the ear, with the ringing in the ear. And the ringing may have a variety of characteristics to it, but yeah, they have that ringing. And also keep in mind that Menieres disease can be bilateral, so it can be in both ears. So that's how Menieres disease has been looked at, diagnosed from a historical standpoint, and then doctors put patients through testing. Typically, they'll do hearing testing. So in Menieres disease, typically you'll see a low tone hearing loss. Doctors will also put goggles on patients that we talk about, because we use these same goggles at Gateswood Health. So they'll put goggles on, and we'll do different eye movement testing, as well as then injecting cold or warm air into the ears. And by doing that, you can create what's referred to as a convection current within the fluid portion of the ear. You can actually check how intact the vestibular apparatus is with that testing. So that's called caloric testing. So after doing all of that testing, if a doctor says, okay, this patient walks in with vertigo, they walk in and the vertigo is lasting 30 minutes to hours, they're having ringing in their ear, fullness in their ears, we do hearing testing, they have low tone hearing loss, we inject warm and cold air into the ear, and we see that one side is not sending the signal, so to speak, correctly, they'll say, okay, this is Menieres disease. So that's how it's diagnosed. Now, do you want me to go into vestibular migraine as well, Kathy?
Yeah, let's talk about the physiology of how Menieres is different from the vestibular migraine.
Okay. And so also keep in mind that, as we talked about last week when we were discussing vestibular migraines versus Maladé-Barkman syndrome, vestibular migraines are a relatively new diagnosis. So vestibular migraines became a diagnostic entity widely acknowledged in the last 10 years. They're still changing kind of what constitutes a vestibular migraine versus what doesn't, in terms of it involves a person who presents who's dizzy. They typically have a history of migraine headaches. When they have the dizziness, commonly they will feel, they'll have some light sensitivity, some sound sensitivity. They may have some nausea. And vestibular migraines, based on this, is actually becoming the most common diagnosis within the dizziness world. So it's actually kind of interesting. In terms of differentiating the pathophysiology, it's become more difficult than we once thought, because when you do the video nystagmography testing with vestibular migraine patients, what we find is that lots of times they have abnormalities too. They have abnormalities in how their eyes track. I read an article this morning where they took vestibular migraine patients during an attack and they did an MRI on them, and they actually found that they had nystagmus where their eyes were moving, like what you would see in a Meniere's patient. And while they had that nystagmus, they actually saw that parts of their occipital lobe were developing what we would normally see in a migraine headache. So Meniere's and vestibular migraines have a lot of overlap, and that's where it's confusing. And we'll probably go into how you can differentiate that based on the newest information, but that's the general layout. Does that kind of make sense?
Yes, it does.
Okay,
and yeah,
good.
I think the differentiation is what we need to really go into, because I think that's the hardest thing for doctors to figure out which one they're looking at.
It really is, and that's where new diagnostic methods have just come out. I was just talking to a friend this week who works in the field of radiology, we'll say it that way. And the newest methods include an MRI of the inner ear. So it has to be a 3 Tesla MRI of the inner ear. So what is 3 Tesla? So most of your MRI, Tesla is, most people now know, people know Tesla. Well, Tesla is a strength of a magnetic field. And in addition to the gentleman named Tesla and the car company and all that.
I was going to say, is it like a car?
Right, like the car. Yeah. So a 1.5 Tesla MRI is kind of the standard MRI that's been used out there. 3T MRIs came out many years ago, but not a lot of people had them because they were expensive. Now more and more people have 3T MRIs. In my experience, more your larger metropolitan areas are going to have 3T more commonly versus your smaller rural areas are going to have 1.5. Nonetheless, a 3T MRI is really powerful. And if they use contrast with a 3T MRI focused on the inner ear, the vestibular labyrinth, that is where researchers and doctors are able to differentiate a vestibular migraine versus Menieres disease. Now, what do they see? What is Menieres disease? Well, Menieres disease involves what you would think of as swelling of this inner ear. It's called endolymphatic hydrops is the term that they use for it. And your inner ear has a very delicate sodium and potassium balance for fluid concentrations. And what they see in Menieres patients is that it seems like the inner ear labyrinth swells and then it can contract, and it can swell and it can contract. In these swelling phases, the structures which sense sound or inner ear motion can be damaged. So what they're seeing on the MRI is that they're seeing signs of the swelling, they're seeing signs of the damage, because with this 3T MRI, they can actually see to a minute detail what's happening in the inner ear. So that's one feature, but the researchers basically still did all the other testing on the vestibular migraine patients and the Menieres patients. So they did video nystagmography, they did hearing testing. What they found is that if you see signs of a weakness in one ear based on the goggles, video nystagmography with the caloric testing, and then you see signs of the swelling and the damage on the MRI, that is the best way to diagnose Menieres disease. I would also say, based on other research articles, you should also see some form of hearing loss, most likely in that ear.
Okay,
So
if you address this and work with it, can any of that hearing be regained?
The hearing being regained, I found, is difficult in my experience. Have we been able to help Menieres patients be less symptomatic with selecting for the right criteria patients, the patients that I've worked with? Yeah, I have seen that. I can't say it's absolute, but I have seen patients improve in terms of their symptoms. And that raises the question, why? And do we have any other questions on autoimmune or anything like that, Kathy?
Yes, we did. What are the connections to autoimmune disease?
So, gosh, I think it was in 2011 or 2012, it started coming out in the literature. It had come out before that, but I think it was a Journal of Autoimmunity sometime around 2011, 2012, where they started postulating that a large percentage of Menieres patients were autoimmune. When I got into practice, Menieres disease was just this idiopathic condition, meaning we don't know the cause. And so researchers started looking at that, and they found that there was a high association with thyroid problems, autoimmunity to the thyroid, as well as other autoimmune conditions, such that the author that I've referenced before in 2017, Chiarella, came out, and Chiarella studies relationships between Hashimoto's, or Dr. Chiarella studies relationships with Hashimoto's and inner ear conditions, amongst other things. But that doctor has been kind of on the forefront of it. And they demonstrated that like at least half of Meniere's patients have a nebulous autoimmune condition or Hashimoto's. So the question is, for Meniere's, why is this inner ear swelling? And it's probably swelling because the duct that drains the inner ear may be kind of clogged, for example, like your shower drain. And so the shower drain is clogged, and so you're not getting all the fluid to come out of it. Other authors theorize that, well, maybe you're producing too much fluid. But one of the current concepts is that the autoimmunity is somehow inflaming the inner ear and not allowing the fluid to come out, or somehow affecting the fluid dynamics. So yes, there is a relationship to autoimmunity. Upwards of 56.9% in one study of Meniere's patients were demonstrated to have gluten sensitivities, rather gluten allergies. So they just did a, like a skin scratch test, and they found that 56.9% of Meniere's patients had a gluten allergy. So that's so important. So if you know somebody with Meniere's, or who thinks they have Meniere's, you really need to talk to them about this, because gluten can be a big issue. And what I've seen, and the people I've worked with, I can't say this, for the whole world of Meniere's patients, but the people that I've seen who seem to have autoimmune conditions, it seems that by changing diet, that may be a prospective treatment for Meniere's patients on the horizon. That's what I would say.
Okay, and we know gluten can cause inflammation. So does it go hand in hand that inflammation can be the swelling that we're talking about?
It very well could be, because we know from other articles regarding gluten that gluten breaks down the gastrointestinal barrier. It does that in everyone. That came out in the journal Nutrients 2015. So even if you're normal and you don't have any health conditions, you eat gluten, your intestinal barrier breaks down. So what does that do? That allows for pieces of bacteria to diffuse in. That creates inflammation, like you're saying, Kathy. If your immune system is attacking the gluten molecule like it's a foreign invader, that creates antibodies that go throughout the rest of the body. Those antibodies can seem to be associated with antibodies that attack the thyroid. The gluten antibodies can attack your cerebellum. And the theory now is that somehow all these antibodies clog that drain. So yes.
Okay.
Mm-hmm.
So is there anything else that you can tell us on the difference between the two?
I think that's pretty much it. I think those are the main points. And so vestibular migraines, now with migraines, we've talked about before, migraines seem to have some sort of inflammatory cause to them. They seem to be associated with thyroid problems as well in general. And I will even say, when we're talking about the goggles and we're talking about the inner ear testing, in individuals who don't have vestibular migraines, but they just have migraines, even those individuals are found to have abnormalities with the standard inner ear testing. So it's very interesting, and that's what's creating such a diagnostic dilemma for doctors, because here you do what you should be doing, the standard workup for someone who you think has Menieres disease, and a vestibular migraine patient may present with this exact same findings, but they have a completely different causation to their symptoms. And so that's why it really is confusing. And that's why I'm excited about the new MRI imaging of the inner ear, because I really think that's going to be the new diagnostic standard in years to come. When you look at the prevalence statistics of Menieres patients, they say it's like somewhere around 200,000 individuals have Menieres in our country. But if you work in the dizziness world, you will see that a lot of doctors diagnose patients with Menieres disease. Do all these patients have Menieres disease? And that's the new question. Probably a percentage of them actually have vestibular migraines, but we'll really be able to differentiate those in the coming years. I will also say horizontal BPPV can be a common cause of vertigo or dizziness in patients. And lots of times I've seen those people labeled as Menieres if they haven't been through the standard diagnostic workup, particularly with the focused video nystagmography, caloric testing, and inner ear audiometry testing. So yeah, that's what I would say. Yeah, so this is a more of a straightforward topic. I don't think we really have any other questions proposed by everybody. I know this is Thanksgiving weekend, but if you, I guess the take-home message is, if you have pressure in your inner ear, if you have, I'd say it this way, if you have pressure in your ear, if you have ringing in your ear, you have vertigo attacks, really make sure you go through a thorough diagnostic workup. If you have nebulous vertigo, if you have dizziness and it's associated with light or sound sensitivity, and you have a history of migraines, you probably want to be thinking about vestibular migraine as your diagnosis. And just know if you have vestibular migraines, when you go through the testing, it may show abnormalities that look like your inner ear is affected, but it may actually be in how your brain stem is computing all of the signals from your inner ear. Because your inner ear sends 1 million signals a second for your vestibular system, your balance system, 1 million signals a second from each side. And all of that has to be computed in your brainstem and modulated by your cerebellum. So if your cerebellum isn't working well because you're not getting enough blood flow there or to your brainstem, that can create similar findings, signs on testing, and symptoms as Menieres disease. So take-home message, get an MRI of your inner ear, get the caloric testing with video nystagmography, and you probably want to get hearing testing.
Okay.
Yeah.
Sounds like that would take care of it.
Yeah. Oh, we do.
Or at least tell us what you're dealing with.
Exactly. And then we have one question, tinnitus question. When I lay down on one side, my ear sounds like it's dripping water, and then once full, it stops. Neurologist said it's just tinnitus. Have you found this to be true? Boy, that's a peculiar presentation of tinnitus. So I would say I would really like to make sure that if I saw a patient like that, I would get imaging of the brain, and I'd probably even do some dedicated imaging of the inner ear to see what is going on there, because that's an odd sequence. And if it were me, I'm not diagnosing this individual, but if it were me and I saw a presentation like that, I'd probably get an MRI and a CT of the inner ear, just because there's something called semicircular canal dehiscence, which more presents with someone who hears loud sounds and they get vertigo, but you can actually get a leak of fluid out of there. There's also things called perilymphatic fistulas, I believe that's the term for them, and those can present with actually the fluid from the inner ear dripping out and can be associated with vertigo. So those are the diagnostic considerations I'd be looking at. And do we have any more? So many people came into the clinic with vertigo-like issues. Okay, great. I love that comment. And neurologist said to see individual doctors. Which doctor to see next? So for that question relative to the dripping and the tinnitus, I would definitely see an ear, nose, and throat doctor who specializes in dizziness. Lots of times in big areas, you have a lot of ENTs, and ENTs frequently will, they're doing hearing aids, they're doing different surgeries to remove nasal polyps or other issues, but frequently there'll be a couple ENTs that focus just on dizziness, so I would see someone like that. If you can, I would also see a chiropractic neurologist, because chiropractic neurologists, or functional neurologists as they're termed, are focused on these things. So that would be what I would say, and that's certainly something that we look at as well. All right. So anything else,
Sounds
Kathy?
good. No, I think that's pretty much covers those two and answers our questions.
Okay, great. All right, everyone. We'll have a lovely weekend. We'll be back next week with another topic. Send us your questions. Send us anything you want us to talk about, and we will go from there. All right. Just we'll end live video. And there, and there. Okay.